Keir Starmer's three-point plan to reform the NHS, shifting from hospitals to community care, moving from analogue to digital systems, and transitioning from treating illnesses to preventing illness, sounds ambitious, but it falls short of addressing the core issues plaguing the NHS. And as somebody who's actually going through all this at the moment, it seems personal. These proposals risk being more about optics than any meaningful change. Firstly, Starmer's call to move from hospital to community care is not new. The challenge is that underfunding in primary care has already left community services stretched, and without substantial investment in staff, facilities and training, the shift risks simply overloading an already strained system. While bringing back the family doctor and expanding digital consultation sounds modern, rural and economically disadvantaged areas lack the infrastructure to implement these changes effectively, and true reform requires addressing the wide disparities in healthcare access across regions. But, of course, the family doctor and making one person directly responsible for GP services, that is a positive. That is a positive, rather than making the bureaucracy, this uninformed, this behemoth of nonsense, responsible. We are not treated by the NHS, we are treated by an individual. Secondly, moving from analogue to digital is indeed necessary, but focusing only on technology risks overlooking the deeper systemic inefficiencies. The real issue lies in the fragmented nature of NHS data systems, which often don't communicate with one another, and when they do, they communicate erroneously. Fixing the technology means more than just implementing digital tools. It requires an integrated, interoperable system where all NHS services can share patient data effectively and securely, and this would cut delays and prevent miscommunication between services. And without this step, digitisation efforts might only add layers of complexity, will only add layers of complexity, and will simply magnify and increase the bureaucracy itself. The bureaucracy is something that needs to be trimmed, and it's in the areas of the bureaucrats don't go on strike, do they? The people who go on strike are the people who aren't getting enough money or enough recognition for the hard work that they're doing. The people who never go on strike are the people who are sitting pretty in their offices, protecting their own jobs and each other's jobs. And most of these people haven't had the training of the doctors and the nurses who are actually working really hard. And yesterday, I had a really nice chat with a fellow called Michael, who was simply shoving a trolley, and he was waiting while I was being treated. And he was simply an angel. And I was really impressed. I was really impressed with his attention, his care, and his thoughtfulness. And I was equally impressed with the nurses who just could not do enough and spent extra time with me, simply because I was in discomfort, and it could not have been. They could not have been more helpful, and yet the blood work which was going through the NHS, and which had been occasioned by a crisis 6 weeks ago, has still not been processed, and that's because it's in the system, and because it's independent of any form of nurses or doctors or consultants. It's something which is in the system, and in fact the system was reluctant to take it in the first place. I went to my GP after I called 111 or 999 or whatever it was when I had my crisis, and I got a really nice fellow turning up who oddly was from Iraq, and he'd gone to Oxford, and we had a lot to talk about, and he could not have been nicer, and he could not have appreciated the problem more directly. And he directed me to go to my GP. I went to my GP. I saw a locum who wasn't sufficiently up on all the systems. He sent me off for a blood test. The blood test, when I got to the local hospital, they wouldn't process it because I didn't have the paperwork, which the GP practice then told me was the result of my being seen by a locum, not by one of the ordinary practice, and that he didn't know the procedure. So I then had a second appointment to get blood, and And for some bizarre reason, the blood test, which I thought when I looked at it seemed wrong, the blood test was to check me for anemia, which wasn't the issue. The issue was cancer. And there is a very specific test that can be done. And that test wasn't done. And I had to wait until my consultant got back from holiday before my consultant, of course, span everything immediately into action the moment he discovered. And he was appalled by the treatment I'd received. And yet, even with that kick, the system still doesn't kick into action because nobody is actually personally responsible for these blood tests. And you think, well, actually, in any other country, those blood tests would come to me. And I would know. But not in Britain. Because in Britain, there's still this patina of authority in the idea that the doctor knows. The doctor doesn't know what he's doing or what she's doing. The doctor has no idea. And anyway, it was a locum. So bits of the system work well. And particularly those bits which interface directly with the patient. But the bits which go on behind the scenes, on which everybody depends, don't work at all. And one hospital doesn't talk to another hospital, which is where I had problems the last time I was in hospital. It is chaotic. And it's chaotic enough to actually risk serious damage. So the last time I was in hospital, because the Coventry hospital didn't talk to the Oxford hospital, as they said they were going to, as I instructed them to, because I'm on the haemophilia scale, they gave me the wrong medicine to deal with my blood. And so a week after my surgery, I started bleeding uncontrollably. Of course I did. That was entirely predictable if I hadn't had the correct drugs. I didn't have the correct drugs because the haematology people in Rugby, in Coventry, thought they knew better than me and thought they knew better than my than the haemophilia department in Oxford. And there's a point at which you just want to tear out your hair. I would, except it would produce bleeding. And it's madness because it's not a joined up system. And you have two choices. You either join it up through a coherent system of authority, and the patient is just a little insignificant rat in the system, and we all trust the system, or you join it up through the rats. You give the patient control. Now, in most countries, the patient has control, and the patient assembles all the information and takes it through to the hospital or whatever. In Britain, we still have this absurd idea that the doctor is right. The doctor is wrong because the doctor doesn't know what they're talking about, because the doctor cannot control the wider NHS. And that is the problem. So to get to Starmer's last point, Starmer's shift from sickness to prevention is aspirational but vague. And preventative healthcare requires tackling social determinants like poverty, housing, education. And how has he done that? By cutting the pension welfare help. And if you don't tackle poverty, housing and education, that alone contributes significantly to ill health. He's right. But this will take decades to bear fruit. And while the NHS is already on the brink, we need to do something now. What we do now is trim the bureaucrats. And preventative care must be backed up by immediate investment in primary care, health education, access to early intervention programs, particularly in the most deprived areas where health outcomes are often worse. Lord Darcy's review rightly identifies the NHS's critical state, particularly its long waiting lists and poor public access to care. However, his findings offer a pathway for real reform, which would involve cutting unnecessary bureaucracy. That is the key. Ensuring NHS systems speak to each other seamlessly. That is the key. And rebalancing pay to prioritise frontline workers. That is the key. Those are the three priorities, not this rubbish of vagueness that has been put out by the BBC. Currently, bureaucratic inefficiencies and excessive management costs weigh the system down. Cutting red tape, increasing the pay and support for frontline workers is essential to ensure the NHS can attract and retain a workforce that it desperately needs. And to this I would add my own rider, that the focus on whistleblowers and silencing, muting whistleblowers needs to stop, because too much money is wasted in trying to gag the people who are identifying the problems in the system. Rather than gagging the whistleblowers, they should be paid extra and encouraged to speak their minds. We need to hear from the people who are disgruntled, who are identifying problems. In fact, it is part of the NHS code to identify something that is wrong. And to punish somebody for doing that is to spear the NHS in its own foot. And the list of ministers who have been complicit in silencing whistleblowers is astronomical. It goes back many years. I've been talking to whistleblowers. Believe me, I've heard the stories. And Starmer has spoken of bold action. Well, that's just words, isn't it? Cross-party cooperation, great. But his plan lacks a clear, transformative vision. At the moment, it is just rhetoric, and it's not the right bit of rhetoric. While his focus on systemic reform is necessary, without addressing the root causes of inefficiency, staffing issues, the indulgence of the bad, and unequal access, the NHS risks continuing in decline. And no amount of rhetoric is going to stop that.